Hello, in this video we are going to discuss Rafi point 238 and 239, and we are also going to discuss the leftovers of the point 240. Point 238 and 239 are related to cervical fascia. Cervical fascia is superficial cervical fascia and deep cervical fascia. Superficial cervical fascia is a thin layer of connective tissue that encloses the platysma muscle. Also embedded within it are cutaneous nerves, superficial veins, and the superficial lymph nodes. There can be an MCQ related to superficial fascia of the scalp. Superficial fascia of the scalp is a mixture of loose areolar and adipose tissue, as we have discussed in the video of the muscle of the scalp. Deep cervical fascia supports the muscle, vessels, and the viscera of the neck. In certain areas, it is condensed to form well-defined fibrous sheet. The investing layer, pretracheal layer, and prevertebral layer. It is also condensed to form the carotid sheath. The MCQ related to deep cervical fascia could be the fascia enclosing the masseter muscle is deep cervical fascia. Investing layer is a thick layer that encircles the neck. It splits to enclose the trapezius and sternocleidomastoid muscle. So if there is an MCQ regarding the investing layer of deep cervical fascia, so what is true regarding the posterior triangle of the neck? That its roof is formed by the investing layer of deep cervical fascia. We talk about the pretracheal layer. The pretracheal layer is a thin layer that is attached above to the laryngeal cartilages. It surrounds the thyroid and parathyroid gland. They form a sheath for them and encloses the infrahyoid muscle. CQ could be thyroid gland moves with swallowing because it is enclosed in which fascia. So the fascia enclosing the thyroid gland is the pretracheal fascia. The vertebral layer is a thick layer that passes like a septum across the neck behind the pharynx and the esophagus and in front of the prevertebral muscle and the vertebral column. It forms the facial floor of the posterior triangle and it extends laterally over the first rib into the axilla to form the important axillary sheath. So the MCQ could be axillary fascia is derived from prevertebral fascia. The prevertebral fascia encloses which of the following? It encloses the dorsal muscle of the cervical vertebrae. That it has mentioned that it lies in front of the prevertebral muscle, so it encloses the dorsal muscle of the cervical vertebrae. Moreover, the axillary sheath is a continuation of the prevertebral fascia. Axillary fascia is derived from the prevertebral fascia, so it is repeatedly asked about the prevertebral fascia. Then an infection of the prevertebral fascia can spread to superior mediastinum, whereas the infection outside or interior to pretracheal fascia can spread to anterior mediastinum. So pretracheal layer infection is going to go to the anterior mediastinum and prevertebral layer infection is going to superior mediastinum. Carotid sheath, that is a local condensation of the prevertebral, the pretrachea, the investing layer of deep fascia that surrounds the common and internal carotid arteries, the internal jugular vein, the vagus nerve, and the deep cervical lymph nodes. Related to carotid sheath, regarding carotid sheath relations, is that it continues inferiorly to merge with adventitia of the aortic arch. Two more fascia in this point, that is Gerota fascia, that is the fascia surrounding the kidneys. So if there is an MCQ, perinephric fat in kidney is enclosed by Gerota fascia. Trauma to one kidney without the perforation of this fascia, the blood goes to inferiorly to the pelvis if this fascia is not perforated. And then regarding kidney, which is true, it is enclosed with respect to suprarenal gland in the same fascia. What is important is related to the upper limb, and that is the clavipectoral fascia. So which vein is present in clavipectoral fascia? The answer is going to be cephalic vein. About the point 238 and 239. Now we are going to discuss some leftovers of the 240 points. We are going to discuss anterior triangle of the neck. The anterior triangle of the neck, the boundaries of the anterior triangle is anteriorly there is a middle line of the neck, posteriorly is the anterior border of sternocleidomastoid muscle, and superiorly there is a lower border of the mandible or the body of the mandible. Anterior triangle is further subdivided into carotid triangle, submental triangle, digastric, and the muscular triangle. Carotid triangle is between sternocleidomastoid muscle, posterior belly of digastric, and superior belly of omohyoid, whereas submental triangle is between a hyoid bone, right and left bellies of digastric. Digastric triangle is also known as submandibular triangle, and that is related to inferior edge of the mandible and anterior and posterior belly of digastric. Muscular triangle is present in the middle line of the neck, and they are surrounded by the sternocleidomastoid muscle and superior belly of omohyoid. There is also a discussion about the lumbar triangle, that is present in the lower limb. So it could be an MCQ that lumbar triangle is anteriorly related to posterior part of which structure. So answer is going to be external oblique. Or it could be asked anterior boundary of the lumbar triangle is formed by the posterior border of the external oblique muscle. Thank you for listening. Keep watching for more videos about FCPS part 1.